tired of long waits, confusing bills, and feeling rushed during your appointments? Here's something most people don't realize. Your visit to the doctor, urgent care, or even hospital can go a lot smoother and cheaper if you know a few insider tips. In this module, I'll share simple, practical strategies that real healthcare workers use every day to cut down on the waiting times, avoid billing headaches, and get the most out of every visit. By the end, you'll know how to walk into any appointment prepared, confident, and ready to make the system work for you. All right, for this module agenda, we have bring the right paperwork every time, use patient portals and online tools, the best times to schedule, how to avoid billing surprises, build good relationship with staff, extra pro tips for smoother visits, handling delays and frustrations, the big picture, closing, and next step. Have you ever had a visit delayed or rescheduled because something was missing, an ID card or old paperwork? If you walk into an appointment tomorrow, how quickly could you pull up your insurance information and medication list? Bring the right paperwork every time. One of the biggest reasons visits drag on isn't a medical emergency, it's missing information. When staff have to hunt down insurance information, medication lists, it slows everything down. Always bring these items: your insurance card, a photo ID, driver's license or state ID, a list of your current medications, include dosage and timing, add supplements too. Any recent test results or discharge papers if this is a follow up. Now, here's a pro tip: take clear photos of these documents and store them in a secure app or folder on your phone, not your public camera roll if it can be avoided. If you forget your wallet, you still have what you need. Now, here's an example. Jasmine showed up for her specialist visit and realized she forgot her insurance card. Because she had a photo on her phone, check in took 2 minutes instead of rescheduling. That one habit saved her a week. Think of it like boarding a flight. You wouldn't show up without your ID and ticket. Healthcare works the same way. Do you have online access to your main clinic or hospital? And if so, how often do you actually use it? What part of your visit causes the most hassle that a portal might simplify? Forms, messaging, results, or bills? Use patient portals and online tools. Most clinics and hospitals now have patient portals or mobile apps that save time before, during, and after your visit. They're not just for test results. You can use them to pre-fill forms before your appointment, cut down waiting room time, message your doctor or nurse without phone tag, review bills, EOBs, explanation of benefit links, and make payment securely. Check labs and visit summaries as soon as they're posted. Now, here's an example. David used to bring a clipboard worth of forms to every visit. He now logs in the night before, completes everything online, and walks straight back when he arrives. It's like a TSA pre check for healthcare. Now, here's a pro tip. If your portal allows uploads, snap a picture of any new medications or supplements them so your care team has the latest information. Think of your portal as a personal health dashboard. The more you use it, the less time you spend waiting. When do you usually book appointments? Whenever there's an opening or at a specific time of day? How much would it be worth to you in time and stress to cut your average wait time in half? The best time to schedule. Ever notice how morning appointments seem faster? They usually are. To shorten your wait time, book the first appointment of the day or the first after lunch. Avoid late afternoon slots when delays tend to pile up. If you must go after work, ask whether your clinic offers short express visits for simple needs. Now, here's an example. Monica used to book 4 p.m. appointments and wait almost an hour. She switched to 8:15 a.m. and is usually out before 9. When you choose smarter times, you spend less time waiting and more time with your provider. Have you ever opened a medical bill and thought, where did this even come from? Before your last test or procedure, did you check whether the facility and lab were in network, or did you just hope for the best? How to avoid billing surprises. A smooth visit isn't just about speed, it's also about protecting your wallet. Healthcare billing can be confusing, so here's how to stay ahead. 1. Confirm network status. Check that both the provider and the facility slash lab are in network. A doctor might be in network, but the lab in the same building may not be. 2. Ask about separate charges. Ask if labs, x rays, or screening will be billed separately. A quick question can prevent a surprise bill. 3. Call your insurance if you're unsure. A 5-minute call to the number on the back of your card can confirm coverage and your expected copay and coinsurance. Now, here's an example. Before MRI, Carlos called his insurer and learned the hospital imaging center was out of network. He switched to a partner clinic 5 miles away and saved $600. Now, here's a pro tip. Always ask for an itemized bill. It lists every charge and makes it easier to spot errors or duplicates. Billing errors are common, so a quick review can literally pay off. A 5-minute call and 2 questions can save you hundreds later. How do you usually feel walking up to the front desk? Rush, stress, or calm? When was the last time you thanked a scheduler, nurse, or billing staff member for helping you? Build good relationships with staff. This might be one of the most overlooked tips of them all. Be kind to the front desk and billing teams. They handle scheduling, insurance verification, referrals, prior authorizations, and follow-ups. The behind the scenes work that make your visit possible. When you're polite and patient, they can often go the extra mile, squeezing you in sooner, expediting a referral, or clarifying a bill. Now, here's an example. Mr. Rodriguez was always pleasant with the front desk team. When his specialist was booked for weeks, the scheduler remembered him and called him the next day when a cancellation opened. A little kindness made a big difference. Now, here's a pro tip. If you're running late or need to reschedule, call ahead. It helps the staff keeps the day on track and shows respect for their time. Healthcare is still a people business. How you treat the team often shapes the help you get. If you had a visit checklist, what would be on it? ID, meds list, questions, support person. What's one thing you usually forget to do before or after a visit that you'd like to fix? Extra pro tips for smoother visits. Here are a few bonus strategies frequent patients and insiders swear by. 1. Arrive 10 to 15 minutes early. It covers parking, check-ins, and any unexpected forms. 2. Keep a visit kit, a small folder or pouch with your insurance card, ID, medication list, and a pen. 3. Track questions in your phone. Jot symptoms and concerns as they pop up so you don't forget in the room. 4. Bring a support person for big appointments. A second set of ears help remember instructions and catch details. 5. Check your portal after each visit. Confirm your medication list, instructions, and next step. Rush notes can miss things. Now, here's an example. Emily kept note on her phone for questions about a new medication. Her doctor answered each quickly because she was organized and clear. The more prepared you are before you walk in, the less you have to worry about once you're there. How do you normally react when scheduling is running 30 to 60 minutes behind? Tense, quiet, irritated? What would it look like for you to advocate for yourself calmly instead of just stewing in the waiting room? Handling delays and frustrations. Even when you do everything right, healthcare can still run late. Here's how to stay calm and make the most of it. Ask politely how long the wait might be. They can often give you an estimate or let you step out briefly. Use the time to update forms or your portal profile. If you must leave, reschedule before you walk out. No shows can mean fees or lost priority later. Now, here's an example. After waiting an hour for her lab draw, Nina kindly asked if they were running behind. The tech apologized and brought her back next. A simple conversation solved it. Delays happen. Staying patient and respectful usually gets you help faster than getting angry. If you use even two of these tips consistently, which one would change your experience the most? Paperwork, timing, billing checks, or preps? How would you like to feel after a visit? Rushed and confused, or clear and in control? The big picture. 1. Bring the right paperwork. Keep digital copies. 2. Use patient portals to save time. 3. Book smarter appointment times. 4. Double check insurance details to avoid surprises. 5. Treat staff with kindness and respect. 6. Arrive prepared and stay patient. Each small step adds up to a faster, less stressful, and more affordable experience. What's one pro tip from this module you're willing to try at your very next appointment? And congratulations, you completed the TJ Healthcare course, Healthcare 101. You've learned how the system is structured, who's who in healthcare, where to go when you're sick, and how to make your visits as efficient as possible. What's next? Well, we have a list of courses for you to help you on your healthcare journey. I will see you in the other healthcare courses. Thanks for watching.